Hello and welcome. Let's talk about antifungal drugs. Now, fungal infections may be superficial or systemic. Superficial infection includes Tiriasis versicolor or dermatomycosis. Systemic includes systemic candidiasis or cryptococcosis, bastomycosis, histoplasmosis, etc. Now, human infection increased dramatically because of the increased use of the broad spectrum antibiotics, advances in surgery, HIV epidemic, and cancer treatment. Now, classification of the antifungal drugs. According to use, it may be systemic use for systemic infection, systemic use for monocutaneous infection, or topical use for monocutaneous infection. Systemic use for systemic infection includes amphotericin B, azoles like ketoconazole, fluconazole, itraconazole, miconazole, echinocandins like caspofungin, micafungin, and anidulafungin. Systemic use for monocutaneous infections include graciofulvin and terbinafine, and topical use includes nystatin, azoles like miconazole, clotrimazole, and alalamines like terbinafine and naftifine. According to the mechanism of action, it may be inhibition of cellular synthesis like caspofungin, micafungin, or alteration of the cell membrane permeability like amphotericin B, nystatin, azoles, or blockade of the DNA synthesis like flucytosine, or disruption of the microtubular function like griseofulvin. This is a picture showing the different mechanism of action or different types of antifungals, where echinocandins like caspofungin inhibit B1, D3D glucan synthesis, etc. Now, amphotericin B is a polyene macrolides and it is fungicidal. It is administered intravenous only and it is broad spectrum. It enters CNS very poorly. The mechanism of action is amphotericin B binds to ergosterol, forms artificial pore in the cell membrane, alters the permeability of the cell, leakage of the intracellular ions like potassium, magnesium, and macromolecules, and cell death occurs. This is a picture showing the mechanism of action of amphotericin. Now, clinical uses includes life-threatening mycotic infection for which it is drug of choice, like severe fungal pneumonia in immunosuppressant patients, cryptococcal meningitis, fungal sepsis syndrome, or mycotic corneal ulcer, fungal arthritis, candidiarrhea. Adverse effects includes immediate reaction like fever, chill, muscle spasm, vomiting, headache, or delayed reaction like decreased glomerular filtration rate, tubular acidosis, decreased potassium, magnesium, liver function abnormalities. Now, azoles. These are synthetic and broad spectrum as well as fungicidal. The route of administration may be oral, parenteral, and topical. The drugs include imidazole like ketoconazole, clotrimazole, and triazole like itraconazole and fluconazole. Pharmacokinetics is that it is well absorbed from GIT, and the antacid H2 blockers decrease the absorption. Poor entry to CNS. Mechanism of action. It inhibits fungal CP150 dependent 14 alpha demethylase and inhibits ergosterol synthesis. It is used for candidiasis, meningitis caused by Cryptococcus neoformans, endemic mycosis, dermatophytosis, aspergillosis. Adverse effects includes minor GIT offset, abnormal liver function test. The advantages of the fluconazole over the azoles is that it can be given both oral and intravenously. There is high safety margin, high oral absorption, high oral bioavailability, better GI intolerance, good CSF penetration, long half-life, longer duration of the action, least effect on the CP50 enzymes, and least drug interaction. Griseofulvin is a fungostatic, narrow spectrum. It is very lessly used nowadays. The source is the penicillium griseofulvin. The mechanism of action is that is energy-dependent transport system and binding to the intercellular microtubular protein, inhibition of the fungal mitosis. It is used for dermatophytosis. Effects include nausea, headache, phototoxicity, and acidic precipitation. Terbinafine. It is a synthetic alamine for both systemic and topical use, and it is fungicidal. It inhibits squalene epoxidase enzyme, which prevents conversion of the squalene to squalene epoxide, and there is increased intracellular accumulation of the squalene, which is toxic to the fungi, and there is decreased ergosterol biosynthesis and fungal death. It is used for dermatophytosis, especially onychomycosis. It may lead to GIT offset. Echinocandins. It is a new drug and well tolerated. It includes caspofungin, micafungin, and anidulafungin. The mechanism of action is it inhibits fungal cellular synthesis by inhibiting B1 3D glucan synthesis. It is used for disseminated and mucocutaneous candida infection and aspergillosis. Effects include GIT offset and histamine release. Nystatin. It is topically used only and not absorbed significantly from skin or mucous membrane GIT, and the mechanism of action is same as amphotericin B. It is used for local candidiasis, oropharyngeal thrush, vaginal candidiasis. Topical agents includes clotrimazole, miconazole, ketoconazole, which is used for oral thrush, vaginal candidiasis, and dermatophytosis. Ketoconazole is present in topical and shampoo form for seborrheic dermatitis and pityriasis versicolor. Terbinafine acts against dermatophytosis and more activity against the Tinea corporis and Tinea cruris, and not active against candida. End of the topic.